Hello everyone, I am Malvika Goradia and I welcome you all to Shantilal Sanghvi Eye Institute's Netra Pe Charcha. Today's conversation is about eye health for children. With us today are our incredible ophthalmologists, Dr. Jenil Sheth.
Hi everyone.
Dr. Nidhi Agarwal. So as we all know, India faces unique challenges in pediatric eye health. In fact, about 2.5% of Indian children struggle with some form of visual impairment, be it cataract, squints, myopia, or retinopathy of prematurity. These conditions, unfortunately, not only impact their sight but also their overall development. Today, Dr. Jenil and Dr. Nidhi will talk to us about common pediatric eye conditions. So let's dive right into our questions. Dr. Jenil, can you tell us, are cataracts really common in children?
Okay, thanks Malvika for the question. So unlike the adults where the chances of cataract keeps on increasing with age, cataracts are not very common in children. However, there are certain geographic as well as certain community-based situations where the cataracts can be common in children. So essentially one must be aware that children can have cataracts and time is the essence when a diagnosis and identifying cataracts in them is at the earliest is must.
Thanks, that's very insightful because usually people just refer to cataracts when it comes to adults, but nobody really talks about cataracts in children. So moving on, Dr. Nidhi, what causes cataracts in children?
So there are many causes of cataracts. One of them is basically hereditary, where it runs in families. Like Dr. Jenil said, there are some community-based higher incidences of cataracts. It can also happen when the mother has infection while the child is still in the womb, or sometimes injury to the eye, and even certain systemic conditions can predispose the child to have cataract.
Okay, thanks for those insights. So, Dr. Jenil, when should a parent actually bring a child in for cataract? What are some signs and symptoms that they should try to observe?
Right, so the symptoms of the cataract in a child may overlap with certain other eye conditions. But however, a parent must be aware of certain things. Like when the child is not able to fixate to objects or unable to recognize their faces. We are talking about very small children who are less than 1 year old. So by 6 months, if the child is not able to identify their parents, identify their faces, that means that the child has some eye condition. Could be cataract, could be one of them. Situation like there is shaking of the eyeballs, what we call nystagmus, is another situation where cataracts could be one of the reasons. So this is one sign the parents must be aware of. In little older children, toddlers and those who are in school going, if the child goes very close to the objects to see the details of it, or the child is going close to the classroom board, or the child is squeezing the eyes, making efforts to see, these could be one of the symptoms and signs of cataract in a child which overlap other ocular conditions. But broadly, these are the signs and symptoms where all the parents must be aware of that the child could have cataracts.
Fair. That's really good insight because when a child has any physical ailment, it is very easily identified. When it comes to eyes, a lot of times it goes missed. So going on with that, is it really harmful if the cataract is left untreated in a child? And what is the timeline? Like when is the right time for them to come in once they observe something like this?
So once you, like Dr. Jenil said, once you observe these symptoms in a child, you should immediately bring them to a pediatric ophthalmologist, get their eyes examined. And if there is cataract, it needs to be treated as early as possible. A delay in treatment could affect their vision and cause development of lazy eye. Or if no treatment is taken, they can even go into blindness. So it's very necessary for them to come in early and get the treatment as early as possible.
Okay. And what are the type of treatments that we offer for cataract for children? Is it the same as those that we offer for adults?
So once you develop cataract, whether it is a child or adult, it's basically you are developing an opacity of the lens which is inside the eye. So it has become now more and more whitish, not allowing the light to enter inside the eye. And so very often, one more point which I can add to my previous answer is that many parents also notice something white is there in the eye. And this also warrants an immediate attention to an ophthalmologist or a pediatric ophthalmologist. So coming to the treatment, the surgery is the mainstay, just like adults. However, Here there are many other factors, and each child has to be catered differently. Unlike the adult population where the surgery is quite routine, in children there are many other factors to be considered before planning a surgery. There are challenges with calculating the power of the lens which is to be implanted in the eye. There are also challenges of whether the lens has to be implanted in the eye or not. But if you want a single answer that what is the mainstay treatment, surgery is the mainstay treatment. Sparingly, when the cataract is not very dense enough and glasses can be managed by the child and the vision is reasonably good, yes, glasses is also one of the options. But I would keep surgery first and glasses as the second option in the mainstay treatment of children with cataracts.
Thank you for that, and I'm sure our viewers will find that very insightful. So, apart from cataract, another common eye condition that we see in children is squint. So, what is a squint?
So, squint, also called as strabismus in medical language, is basically either a deviation or a misalignment of the eye. So, whenever you look at a person, you see both eyes are quite straight, but whenever you notice that the eye is either moving in or moving out when the person is looking straight. So they are not well aligned, they are misaligned. It could be in, it could be out, it could be up or down. So that essentially comes under the umbrella term which is called squint or strabismus. In Hindi they call it tirchi aankh hai, and Gujarati trasi aankh. So that's different terminologies what they use. How common is that in children and adults? I would say it is much more common as compared to the cataracts what we just spoke about in children. So squint is very much common. Not identified or identified and not taken care of at the appropriate time is the reason why squint is not much addressed in concerns when it comes to common ocular or eye conditions in children.
Okay, and what are some causes of squint?
I'd like to add something to Dr. Janel's answer. So it's often a misconception that parents feel only one eye is squinting. But usually the squint is between both the eyes. It's normally not only one eye, it's both the eyes basically. One eye may be majorly squinting, but the squint is always present between both the eyes.
And visually, do they see any difference in how they see versus a normal eye would see?
So one of the reasons why squint needs to be addressed very early, just like how cataracts in children, time is the essence to identify, and what Nidhi mentioned that early intervention is must.
Okay.
Even for squint, unlike what the knowledge is around in the common people, it needs to be addressed first because it is very likely that the child will only prefer one eye and will neglect the squinting eye, and they develop something called as lazy eye. And there is a specific duration up to which we can treat lazy eye. So once the lazy eye sets in, reversing the condition is a very tough job, and very often you may not be able to. It's an irreversible cause of visual impairment or blindness, you can say, in certain children. So treating and addressing squint at the earliest by many methods, not necessarily surgery, is very important. So yes, when you say whether it is visually threatening, I would say yes, squint can be visually threatening.
And what are some causes of squint? Like, why do they develop this?
So there are again many causes. Like in cataract, squint also has many causes. Anything that impairs a child's vision, बच्चे को अगर दिख नहीं रहा है अच्छे से, चश्मा है उसे या cataract है, those things can induce development of a squint. Even certain brain conditions, neurological conditions can cause squint, and also thyroid, which is a common endocrine disorder, can cause squint.
So one of the points which I would like to add here is in India compared to the Western world, one of the simple and most common cause of squint what you see in address in clinic, which may be identified by the parents or missed by the parent, is this simple pair of glasses. So refractive error, need for the glasses which was uncorrected, is the reason for development of squint. Moment the child wears glasses, the squint is corrected.
That was very informative because बहुत लोगों को मालूम नहीं होता है कि सिर्फ चश्मे से squint fix हो सकता है. So, Dr. Janel, what are some symptoms of squint?
Symptoms of squint, I would say symptoms and signs, so what you can very obviously see. Again, similarly, like I explained before, that the parents will notice that the child has an eye which is intermittently going in and out. So child will not complain anything because child is able to see everything quite clearly because the child is unaware which eye is going in or out. So what parents notice that the child occasionally drifts when he's looking very far. जब वो बहुत दूर देखते हैं एक आंख थोड़ा साइड में चला जाता है. That's the common complaint the parents. They are not unaware what is happening. They don't know इसको squint बोलते हैं. So that is the most common complaint or sign that parents notice in a child. Otherwise, where there is a gross misalignment, that is the eye is very in or out or up or down, which are different types of squint. It's very obvious right from the birth that the child has squint, and the parents usually come very immediately to address that what is abnormal in my child. When you come to pure symptoms, yes, there are certain situations where the child will complain that when he goes in the light, he is not able to tolerate the light in one eye. So they tend to squeeze, they tend to close one of the eyes. This is a common complaint in a particular type of squint. Okay. And like I said that, for instance, if one becomes aware that one of the eye has blurring of vision, or for some reason both the eyes have blurring of vision, or clear nahi dikh raha hai, so again it's a sign symptom similar to where anyone could have eyesight. They tend to squeeze, they tend to go closer to the board, they tend to go closer to the television to look at the objects, are also some of the signs and symptoms of squint. When it is because of one of the reasons which Nidhi happened to mention, neurological. The child had no squint, the patient had no squint, and suddenly it appeared. So commonly they would complain before misalignment, they would complain double vision. Sab do dikh raha hai. So this usually happens in little older children and adults where there is squinting. Squint is, like I said, an umbrella term. The reasons are many, which Nidhi has enumerated. And when it is little late onset, double vision is the first complaint, which is concerning. So everything they look at far becomes two distinct images, two distinct TVs, two distinct teachers in the school. So that's also one of a relatively common complaint of older children and adults who have squint later in their life, not earlier.
And we discussed about lazy eye that is developed after having squint, but are there any other harmful effects of having squint?
Definitely. So lazy eye is the one that is very well recognized effect of not treating squint, wherein the eye which is drifting more commonly tends to develop poorer vision than the other eye. Other thing that is very important is a poor hand-eye coordination, poor depth perception. So our aim of treating squint at an early age is so that the depth perception is restored in the child. And also some patients, some children develop a poor motor milestone. They are unable to walk on time purely because they have squinting of eyes and they are not able to coordinate both the eyes.
So overall, a squint can definitely cause visual impairment, but it can also hinder a child's development.
Correct.
Can you give us some examples of what are some milestones that the child cannot achieve?
So I've had patient with esotropia wherein the eyes were turned inwards and the child did not walk properly, maybe till 2.5 years of age. And after surgery, when the depth perception improved, the child was able to walk and achieve that milestone. So that is the power of early treatment of squint in children.
And how is squint managed? Like, what are the types of options that we have, treatment options that we have here?
So the squint is managed depending on what kind of squint we are dealing with. One example she gave was esotropia, where the eye is in, the eye is out. So there are many factors to consider. The biggest factor to be considered is whether the child has eyesight or not. If the child has glasses, in the first examination, irrespective of whatever the type of squint would be, giving glasses is must. The squint always needs to be assessed after the child is wearing the glasses for an adequate and a good amount of time. Now, let's say for an example, the child does not have glasses and the child has a very normal vision and no eye power, no refractive error. Now the question is, what do we do now? All squints do not need surgery. Some squints can be just observed because they may not be visually threatening. They may not be threatening their depth perception. They may not be threatening their 3D vision. They can be observed for a certain period of time. Where there are certain squints which are very immediately have already threatened their development, have threatened their depth perception and needs immediate address. And that immediate address is by means of, provided they don't have glasses, is by means of surgery, injections of Botox into the eye muscles, and by a specialized type of glass called as prism glasses. So prism is a kind of glass which we use for assessment at the same time we also use for management of squint. Because it's such a broad term with so many types of squints, so the management varies from child. But first is to get your child for examination, and the first thing what a pediatric ophthalmologist do is test the eye power if the child has glasses, because roughly I would say 75% of these squints can be managed by glasses alone, roughly. The rest 25% where the options glasses does not take care of the squint is where we start thinking of the other options, which is surgery, injection into the eye muscles, Botox, and prism glasses, which are specialized glasses which helps in reduction of the squint.
One more thing, Malvika, is that many parents are surprised when we tell them we are just going to observe the squint for now. We are not going to intervene. So they come to us ready for surgery because someone might have suggested them for surgery. But when we tell them we want to give you glasses or we just want to simply observe you, they're very surprised and taken aback. So that's very common misconception also amongst parents.
That's exactly what I was going to say, that like I said earlier also, not a lot of people are aware that सिर्फ चश्मा ठीक कर सकता है. So I'm sure the patients are feeling that, is this the correct treatment or not? But like Dr. General mentioned, it is important that we bring the patient in early on so that it's detected early on and it's treated well.
So one of the reasons why squint needs to be addressed, where it may not be a medical reason to treat the squint, but it may be because of the psychosocial impact what the child would be undergoing every day in school, in tuitions, in front of their friends and everyone, and that is often the reason. So every time when a parent comes and the concern is squint, I ask them that is it your concern or is it really bothering the child also? Because I may change my decision for that reason. It may not be medically required to immediately operate the child, and observation, like Nidhi mentioned, that we can observe and parents are surprised. But I do ask them, what is your concern beyond your? If your concern is whether it is visually threatening, then no. I ask the child who is little older enough to understand that is people teasing in school? Are children, friends teasing you about the squint? Does anyone have that realization that do you have squint? And if the answer is yes, then I further deep into it whether this problem needs immediate addressal or I can actually wait and observe for squint. There have been situations where even preschool children were bothered because the child is asking, a preschool of 3 years is asking the mother, why my eye is one side, others are pointing out. Although medically the child required to be treated for squint, but I did an early surgery for them because the child is bothered at the age of 3.5 years. So these are very important examples and may not be medically significant, but the impact which has been studied for the last 4 decades is very enormous, and we may not identify that, but we know what the child is suffering through with the squint if there is bullying and teasing and other things happening in the school. So very important aspect of management of squint. This goes beyond what the routine care we give the children. Absolutely.
So apart from the COVID pandemic, I've been hearing a lot about myopia as a pandemic. Can you tell us what myopia is?
So since the year 2020, though myopia is a condition of the eye called as nearsightedness, where a child or an adult can see near quite clearly, but the distance is far blurry, and this situation has exorbitantly increased. And it's also a parallel pandemic running since 2020, and we have far more number of children suffering from myopia, and the common reason is because of the excess screen time.
And apart from the screen time, are there any other risk factors?
So myopia tends to develop in children who has myopic parents. Mother is myopic or father is myopic or both are myopic. Sometimes it runs in families. You will see family members, all of them coming with thick glasses into your OPD. Also, one prematurity, retinopathy of prematurity, Dr. Bhageshri will be speaking about it, but prematurity also comes with a risk factor of myopia. And nowadays, as Dr. Jennings said, screen time is a major problem that we've seen in children who have higher minus power.
And like you said, it's a parallel pandemic. So with COVID, there was obviously an increase in screen time with school being online and children having more time in the house and not being allowed to go outside was a big factor why parents were allowing children to use more screens.
Correct.
It's not only from there, actually, right from the base where the exposure of the child to a day-to-day routine has changed so much since COVID.
Absolutely.
They are more indoors. And when they are indoors, obviously they are glued to either television or the phones.
So in our day-to-day lifestyle now, screen time has become a big part of our lifestyle. But is there any other advice or lifestyle modification advice that you can give to parents so that they can avoid having nearsightedness?
So, first is mother will always ask, gajar khilana shuru karu, palak khilana shuru karu. So, make the child eat whatever healthy food you cook at home, normal food. You don't need to go an extra mile and add kilos of gajar in the diet. No, that does not work. A healthy, balanced diet is good enough. Second thing is the screen time pandemic is what we warn the child and the parents always in OPD is 30 minutes maximum screen time in a day is all the child needs. And the bigger the screen, the further away it is from you, the better it is for the child. So I always say if you want to see something, see it on a TV, sit at a distance rather than seeing on a tablet and a phone, and 30 minutes maximum. And also studies have come up which have shown that doing physical activity in daylight also improves or reduces the rate at which your myopia increases over a period of time. So going out and playing is very essential for children nowadays.
So we can basically say that going back to the olden days and reducing our phone usage, our TV screen usage, and this is not just for children but also for adults. We all need to work on having that 30-minute screen time, and then going out and taking a walk or going for a football match or something would be useful. Can myopia really increase? Can the power fluctuate or increase? And is there any treatment that we have for that?
So myopia is a condition which definitely increases. It can never decrease. And one of the common questions asked by parents, whether the eye power will come down. So this minus power or myopia, nearsightedness, cannot decrease. And a common example I give them is just like your height. So once you achieve the height, you are never going to reduce in the height, and so it's gradually going to increase. Does it increase in everybody? No. But depending on the risk factors which Nidhi happened to mention, it can increase in many of the children nowadays. So what are the options to control them? If that is the question. First, wearing glasses takes care 90% of your problems. Just wearing glasses is the consensus with the World Society. Wear glasses takes care 90% of the problem. Lifestyle modification is the top of the pyramid when it comes to control of myopia. Healthy habits, healthy eye habits, very less screen time, very good outdoor time, daylight time. And by daylight time it means an indoor time. What you mean is even the way your posture is there while reading. Those who are not on screen but doing excessive near work, again there are certain ways to do good posture, good lighting, good distance of your reading material from your eye, around 30-33 cm or less than 1 arm distance. And again lifestyle modification which you must do so that your myopia does not increase. From our perspective as a pediatric ophthalmologist, there are certain means like eye drops called as atropine, which is low dose atropine 0.01%. For certain children where we advise where there is continuous increase in the eye number. And there are also certain specialized glasses which are manufactured by multiple companies nowadays, which are also indicated in certain category of relatively older children more than 9 years or above, which they have to define certain criteria, then only we give this prescription eye drops or glasses to them. Otherwise, I would still say lifestyle modification is at the top of the pyramid, which will help you in slowing the progression of myopia, may not be able to stop it.
So Malvika, even if we give all these treatment and the child has not reduced screen time or has still not gone out and done some physical activity, these treatment, the effect will be lesser than what we are expecting. So lifestyle modification is the key to reduce the progression of myopia.
So that is very interesting because usually people refer to, like you said, gajar khilao ya palak khilao. There are so many myths associated with myopia or nearsightedness कि ये खाने से मेरा number कम हो जाएगा. And a lot of parents actually do not have the entire knowledge or complete knowledge to know what is right for the child. But these kind of lifestyle modifications, like you suggested, are easy to follow as well. So it is important that our
It's important. The reason that why everyone should know about myopia, and if you look at the bottom line, then why are we talking so much about myopia? It's just simple pair of glasses. and you give glasses and it gets treated. The reason why we are so much concerned about myopia is not what the child will suffer now, what the child will have retina and other serious visual threatening problems when the child is growing to be in the older stage, in the 40s or 50s. You can have retinal conditions which may not be treatable. You can have diseases of the eye which were very less common in the current elderly population. Which these population who are going to be elders in the next 40 years will be suffering because the possibility or the current incidence of myopia is so high. So our goal is to prevent as well as stop the progression or halt the progression and talk about myopia and create awareness. The only reason being because these category of children are going to suffer with certain serious eye conditions in future. As right now the treatment is very simple, just give a pair of glasses and you can see clearly. But the whole thing about talking so much about myopia is avoid serious potential future side effects, and that's why control the condition in